Welcome to part 4, Evaluating and Sharing Impacts of LIFT. As a reminder, I'm Samantha Harden, and LIFT stands for Lifelong Improvements Through Fitness Together. Let's jump right in. The learning objectives for this section are to understand how to assess functional fitness of participants, to be able to understand and communicate the importance of evaluation for participant compliance and program evolution, as well as measure lift impacts and engage in shared use agreements for maintenance. This is a snapshot of the functional fitness assessment. This tool was developed very strategically to help you understand how your participants are progressing from pre-program, post-program, as well as at the 6-month follow-up. We were really strategic with each section of the functional fitness assessment. This is available for printing, or you can do this online on a Qualtrics link that you can create for your state delivery. This includes things like the first 3 letters of the first name, last name, etc., to de-identify the data. But then you also can include your county and your state so that you as the instructor can have county-based or state-based data as needed, whether you have your extension specialist for evaluation helping, or if you're doing this for your own county by yourself. There are a couple of distinct sections for balance, upper and lower body strength, flexibility, and agility. There's also a section for notes, which can be really great for you to be able to communicate certain things that were happening at a certain time point that may be creating noise or confusion in the data. There are 2 ways to conduct the functional fitness assessment. One as a group or individual. These do take about 15 minutes to complete, so they can be resource intensive if you are completing them one-on-one. However, you can also complete them as a group. If you do the group-based version, please do encourage your participants to, again, stay in their range of motion, not use momentum to get into the moves, and to remember that everybody's on a different fitness journey so that we can promote safety and avoid any friendly competition with the person next to them. It is completely up to you whether or not you continue to collect the functional fitness assessment data for LIFT. We have over 8 years of evidence for our Virginia Cooperative Extension version of the program, as well as over 2 decades of work with Strong Women, Strong Bones and Stay Strong, Stay Healthy, showing that this program does help reduce falls and improves functional fitness. But if this is interesting or relevant information for any of your stakeholder groups, feel free to collect this objective data. The other option within our data management is also a pre, post, and 6-month follow-up survey. This gets at things like the socio-demographic profile, perceptions of social connection, and self-reported physical activity behaviors, and intent to continue with strength training after the LIFT program. Another opportunity within your data management is to engage in a shared use agreement. A shared use agreement is where you, as the instructor of the LIFT class, can work out with a specific facility that your participants can continue to use the space for their LIFT class if they continue to do so. Maybe somebody who did the class ultimately does the training and they can deliver the program to others in the community as well. That's one of the many resources available at parseylab.org/LIFT. We also have a very basic and rudimentary way to track physical activity and fruit and vegetable consumption. This is the LIFT tracker. This helps people be able to differentiate between fruit and vegetable consumption, able to capture what type of activity they're doing and for what duration. You can print out 4 of these so that you have each week captured within this, so 4 per participant if you like. They can also use wearable devices or anything else, but remember, these individual level behavior change strategies are around goal setting, self-monitoring, and a feedback loop. So this is just a really simple way for people to print it, keep it on their refrigerator or at their office so that they can track their behaviors. You can ask them to bring their sheet with them when they come for every session, and you can talk through, I'm seeing you're consuming plenty of fruit, but not as much vegetables. How can we work to improve that? Or maybe talking about the duration, intensity, or type of physical activity. So just using this as one of the many tools in your toolbox to promote the behavior changes of interest within the LIFT program. I'll wrap this section talking a little bit more about telling the full story and some other relevant data you may want to collect and report to tell the full story of LIFT. REAIM is a framework that stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. And those 5 domains essentially mean who, what, when, where, how, and why an intervention works. If you're interested in learning more about this incredible framework, please feel free to check out our Journal of Extension paper, where we talk through how extension professionals can apply this framework in their work, specifically looking at different health equity questions that may help us ensure that we're reaching people most in need of intervention, that we can partner with low resource settings, and or maintaining individual level behavior, as well as the ability for our volunteers, agents, and other staff members to be able to deliver programming. So through a REAIM lens, some examples are LIFT is available for all aging adults, and it can also expand the reach of extension programming. Maybe you are able to recruit people who are more interested in the physical activity side, and then they can ultimately take some of your nutrition-based programs. Or maybe they've taken a different program that you offer and it says to increase physical activity, but they're not exactly sure how. This is just an opportunity to continue to show different audience members all of the menu of options that your extension system has available to them. Other things like effectiveness is that we use these behavior change strategies and evidence-based exercise physiology. Anyone who does the training completes all of the steps that we'll talk about in the roadmap that we spoke about in the overview, and I'll revisit shortly. And then you can receive your training certificate and that you engage in strong implementation. And what you can't see on the slide here is that the M is also for maintenance, individual level maintenance, as well as our ability to maintain the program in our county, in our state, and across the nation. So now for one of our final wrap-ups is to talk a little bit more about all of the resources available on parseylab.org/lift. The number of resources here, I can't even begin to count because they can be updated, because you as a LIFT instructor can reach back out to us and say, I need this document, I couldn't find it on the website. If it doesn't exist, we can create it and post it. There's other incredible resources like your session by session program manual, some social media prompts that you can use in between sessions. We even have a language you can use to partner with a local newspaper to highlight or feature LIFT to help you with recruitment. So there's lots and lots of materials, including a slide deck that you can use to do a program overview for that 10 minutes of session 1, or maybe you want to use that as part of your recruitment plan. And we also have if-then statements to help with safety and progression, and just so many other resources. So as part of your 6-hour training, we have built-in time for you to explore the website, find all the materials that are available, and let us know if you can't find something or if there's something else you need, so that you feel confident and competent in delivering this program in your community.